My presentation was the effects of baseball activities and shoulder mobility on the functional arm scale for throwers, also known as the FAST. Baseball athletes are at a greater risk of shoulder injury due to the high force and mechanics that come with throwing a baseball. The objective of the study was to observe the effectiveness of thoracic mobility stretching and arm care exercises in a collegiate baseball athlete's shoulder pain and function within a season through the use of the FAST. There were a total of 17 participants in this study, 14 of which were pitchers, 3 of which were position players. Here we have a few of the questions that are asked in the FAST. The second part of the FAST is a pitchers only module. FAST scores were taken at the beginning and the end of the baseball regular season. The FAST is composed of 22 questions and 5 subscales, which include pain, throwing, activities of daily living, psychological impact, and advancement. In addition to the FAST scores, we measure dominant and non-dominant pec length, as you can see in Figure 1. Figure 2 shows us the second measures that we used, which was the degrees of shoulder flexion through the use of the Sarman test. The pre and post measures of the FAST showed no significant difference between the two time points. The pitchers module also showed no significant change. However, there was an increase in self-rated dysfunction at the end of the regular season. There was a strong positive correlation between dominant pec length and post-FAST scores. There was also a strong positive correlation between the total number of pitches thrown in the game during the season and the dominant pec length. This shows us that when the dominant arm pec length was longer, it was likely that there was a higher number of pitches thrown. The FAST score can determine pain and function in a baseball athlete throughout the season based on patient perception. While thoracic mobility and arm care exercises did not significantly improve our patient's pain or arm function, the FAST scores remained consistent, and there was no decrease in pectoralis length or shoulder range of motion. Therefore, the FAST scale, along with simple physical measures, may help us maintain a patient's level of function throughout the season.